Institute. We welcome you to the go-to webinar regarding the Capital Restructuring Financing Program application. We received some very good news yesterday that the application due date is indeed on February 20th versus the earlier deadline posted of December 22nd. It's certainly to prepare for the capital requests and ensure that they align with our district deliverables. But we thought that we would take you through our webinar today. We have Joyce Rafferty, CFO of Champlain Valley Health Network, the University of Vermont Health Network, and Trip Shannon from Hudson Headwaters Health Network, who will guide you through the webinar. Thanks for joining us.
Good afternoon, everyone. If you're following along on the slides here, we have broken down into 3 sections today, but of course it's on the capital project related to DSRIP. As you can see, we're going to do an overview of the application. I will cover that, the role of the HI in this process. Joyce will cover that. We've allowed 20 minutes for Q&A. The application, we're going to talk about key dates. Well, starting with the actual process itself, it's a $1.2 billion capital project. It's broadly to improve infrastructure, promote integrated health systems, and support the development of additional primary care capacity. It's for projects in the time frame of April 1, 2015 through March 31st, 2020, or 5 years. Again, we mentioned $1.2 billion over 5 years, or roughly $240 million a year annually. Consultants and AHI staff have made a best guess estimate of what that would mean to this region, and we're expecting probably not less than $6 million a year, but no more than $9 million. So we're somewhere between $30 and $45 million over the 5 years. Today's focus is really 2 aspects to the application. We're focused just on Process A. Process A is for participants who are actually in our DSRIP in the PPS AHI. There's a separate process for non-DSRIP organizations where they apply directly to the state. For the purpose of today, we're only talking about individuals who are part of the PPS, where the projects will go through AHI. So a couple of key dates. December 10th, which was originally going to be the due date for the full application, is now AHI is putting together with their consultants a 2-page summary template to be utilized by all the individual organizations who want to apply, and that'll be released on December the 10th. That'll be due on December the 30th. The intent is obviously to provide some HI before all the projects are due on February 20th. The steps in between, the steering committee will review on January 6th the 2-page summaries. There will be feedback to the applicants from AHI by January the 10th. Full proposals will be due to AHI by the 3rd of February. Again, the steering committee will review on February the 12th. And AHI will be submitting the ranked proposals to DOH by the deadline, which is February 20th.
Welcome to the webinar. You have entered as an attendee.
Some additional information. By the way, all this information is on the website and in the application, and in many cases in more detail. But so minimum eligibility criteria, nothing too unusual here. Hospital, residential health facilities, D&Ts, licensed providers, assisted providers, home health agencies, clinics, etc. Again, full listing is in the application. Preferred eligibility criteria. Applicants are committing matching funds to the proposed project. Basically, if you're in a financial position to do so, there's strong preference for matching funds, and they really much have indicated 1-to-1, so 50-50. These can be clearly demonstrated that equity, borrowing, or other sources are not available. There is also a process for those organizations. Applicants with projects that demonstrate transformational change to the system is again preferred. And applicants who demonstrate significant financial need is another possible criteria. Eligible projects. Again, this is a good listing, but not a full listing. Should be no surprises here. Expansion of primary care, behavioral health, and the two of them integrated together. Asset acquisitions that tie to projects. Project lines that support consolidation, infrastructure improvements that support closures and mergers or restructuring, that support telehealth infrastructure, and you can see the rest, but obviously all leading to supporting the DSRIP program goals. Eligible expenses. Again, those pretty much normally associated with capital for those of you folks who are used to dealing in such projects. So planning dollars that go into these for the acquisition, construction, demolition, etc. Construction costs, renovation costs, asset acquisitions, for instance, buying a building and then renovating it. Major equipment costs, again, that equipment that could be considered capital, including, where appropriate, health information. Excluded. Again, pretty much straightforward accounting. These are operational expenses basically listed here: personnel costs, supply costs, utilities, general operating costs, loans and debt obligations. Notice the last one, lease payments. If you're creating space via a lease, you can't submit those lease payments. That would not be considered capital. Evaluating criteria, and again, I would refer folks to make sure you read the application in detail. There is certainly more there, but as boldly suggested up front, there has to be highly aligned with achieving the district goals. Projects that are likely to be evaluated favorably include promote care coordination among providers, promote patient-centered care, medical and health home, reduce avoidable hospital and nursing home admissions and emergency room visits, enroll the largest number of Medicaid enrollees and uninsured individuals, include as much funding as possible from other funding sources, and present a significant financial investment beyond the funding through this process, and a reduction in inpatient beds or continuation or expansion of ambulatory care and emergency services in a community. Couple of points to the application, the sections itself, and somewhat also a reminder. See pages 12 and 13 of the application. To apply, you have to be pre-qualified through Grants Gateway. So please, if you haven't initiated that process, please. And the two main components are a technical proposal, which is basically a description, a narrative, and the financial component or financial proposal. The technical proposal, not to exceed 15 pages, pretty straightforward. A summary, a project description, information on the organization, relationship of the project to community need, relationship to the district goals, and information that elicits that it's part of a transformational change, and any regulatory waivers. You can also note in that slide the significant scoring towards relationship to the project and community need. Financial proposal, again, fairly straightforward. Project funding and match, the project budget, including the source of funds, cost effectiveness, financial viability, including long-term sustainability, and for those where it applies, demonstration of significant financial need, and notice including evidence of IAAF funding. Again, significant points for the project funding and match for long-term viability and for those who can demonstrate significant financial need. Again, our we broke today's presentation into 3 parts. Now we're going to be turning it over to Joyce Rafferty, and she will walk us through the role of AHI and the North Country PPS in this process. Joyce?
Okay, hello. So the first slide I'm going to talk about is really the role that AHI will play in helping all of the participants with their application needs that they've identified. When we are happy and glad that you guys are willing to bear with us, as this is obviously an evolutionary process as it changes on a day-to-day basis. And I know it's very hard for everyone because you're only just now getting your arms around what those particular projects are going to look like within your regions. So it's to get your arms around what the whole region and then roll that up into the PPS for capital needs it's a difficult and time-consuming process. But we're really glad that we have this extra time because we believe we'll have a much better product at the end of the day now that we have until February to finalize these plans. Can somebody move to the next slide? So we'd like to, through AHI, really provide support however you may need it. And again, that'll be evolving as we work through this process. Today's webinar is a good example of doing this application process. The other things that we will do is to provide the community needs assessment data. As you notice what Trip was saying as far as the evaluation, they will always be looking to see that we are identifying projects that link back to the community needs in our region. So that will be key for you guys to incorporate in your application. We also will be taking any Q&A, some of which we'll be able to answer, most of which we'll probably have to forward on, and it'll probably help others in the state because they'll have similar questions. And this, again, like I said, this is an evolving process. The Q&A is still out for folks to respond to the preliminary application, and that's not even due back until December 10th. So, when we speak to the application process and the timeline, those things could all change. But we think it probably will be pretty much consistent with what they've published so far. And then as we work, we may identify other pockets of needs that all of the participants have, and we will see how we can assist you with that. HIT is one that is certainly evolving, and it's obviously critical to our ability to be successful in our district goals because we'll need a foundation from an HIT perspective to be able to track all of the metrics and our progress towards those goals. When we look at AHI and the North Country PPS, really hopes to provide some guidance to help structure some of the projects related to HIT that the PPS participants are looking to undertake. They have a subcommittee that's really looking at just the HIT world. And it's all very complicated, as you know, and we have a short time frame in order to get assist others. So while we might not end up with the most the optimal state, at least we want to focus on a system that really has the basic principles that allows each one of the different participants to feed information and to pull out information where they need it. So the next slide represents kind of a first draft of what we think the landscape looks like and will morph into. It's a pretty complicated slide, but as you look through it, you'll see that there's basically 3 layers, with the first being more the population health management side of things. What we really think makes sense is to try to build on the foundation from an HIT perspective that we've already built as we are working toward a number of other initiatives, including the health home, the patient-centered medical home, and other initiatives. We've got some infrastructure in place, and we'd like to build and expand on that so that it meets the needs of our PPS. And then on the bottom is really all of the various systems that each one of us as participants have, and making sure that they all into the regional infrastructure. Some of our participants may not have any kind of a record, so those are ones that would most likely be a priority to get some HIT capital dollars so that they are no longer working with paper, so that we'll be able to track some of this information more real time. But I'm going to ask Dan McGovern from AHI to see if he can walk us through this slide in a little bit more detail.
Thanks, Joyce. I couldn't have said it better myself the way you framed it. We're basically looking at 3 layers, the bottom layer being level 1 at the organizational level. What type of electronic records do we have in place, and what are the capital requirements that we're going to, or capital costs we're going to need to go after in order to connect so we can do data sharing amongst one another through a local RIO. We're looking at Hicksney and the existing infrastructure that we have in place. We're looking to leverage that, and then also the payer claims, tie that in to eventually populate up into the population health management solution so we can do our performance management. But we did send out a survey to all of our member organizations asking them for their existing systems, what EMR are they on. Some of them don't have one, so that would be a capital cost. And then some of them may have an EMR, but it's not capable to connect to the RIO, so we'll have to look at some of those things with each of those provider organizations.
So as Dan mentioned, for the short term, we really want to focus on using the RIOs to be our basic data sharing. Might not be the most optimal. It's what we have at the moment, and so we really want to leverage that tool. And looking at population health management, that's not something that each one of the participants needs to worry about. That'll be something that will be built into the infrastructure at the PPS level, because we definitely need to have all the systems feeding and populating that database so that we'll be able to roll up and take a look at those various metrics. Just talking about the PPS Application Prioritization, again, the Department of Health has specified that the Process A applicants, that being those that are associated with DSRIP, will be submitted to the PPS, and the PPS lead will rank all of those applications and will submit them all together on behalf of the PPS. Originally, they were all supposed to be submitted at the same time as the overall PPS application, and now it has a separate due date, but still will be submitted through the PPS in one big pile. And these will be prioritized basically by the PPS Interim Steering Committee, and they've established criteria that really mirrors many of the bullet points that Tripp went through when he was talking about the criteria that the health department will use to prioritize. We thought it only made sense for our PPS Interim Steering Committee to use very similar criteria. So I will just walk through those again. But for the most part, it's making sure that the project is aligned with the goals and strategies that we will be including in our DSRIP projects. Just want to make sure that they're investing in capital dollars that will help us be successful. Making sure that we're hitting the right target populations through this infrastructure. And primary care, obviously, when looking across our region, there are some gaps in primary care, and to keep folks out of the ER and out of the hospitals, we certainly need to improve access, and that's why the health department has that as a priority. And mental health, as we know, that's a major focus of all of these projects, so it'll be rated higher if it is addressing some of that capacity. Coordination of care among providers, as we all know, if we can improve the handoffs of care, that we will improve the decrease costs most likely. Avoiding hospital admissions and nursing home admissions and emergency room visits, if it addresses that, that'll give it a leg up. Looking if it addresses other funding sources, if you're bringing in the potential for another grant and or borrowing money or using cash that you have available, that will increase scoring. Reducing inpatient beds, as Tripp mentioned, that would also improve the scoring. Looking at crucial infrastructure that's needed to promote access and essential services. Another area is looking at financial sustainability. Will the capital dollars help an organization that is critical to its community maintain its solvency? Then it would be rated higher. So basically submitting successful projects. The capital application process is going to be highly competitive, and this is an area that became very apparent to us when we started to look at some of the projects that we know our participants have envisioned. Everyone has a very healthy capital appetite, no surprise to anybody on the phone. So it's going to be very competitive, and they need to be ranked within our region, and then the state will do their ranking. I think we all need to make sure that the projects that we submit are ones that fit within the district goals, and that we don't use this as an opportunity to kind of try to get everything we ever wanted to do funded. I think that's why the state is suggesting that having a match is very important, because it'll stretch those capital dollars much farther. So we think it's also important that folks don't commingle all of their projects. So for example, if there's one that's very key to the success of district, and you've kind of associated a project that really doesn't have as much association with that project, it may be better to just pull that out. Otherwise, you might dilute the scoring on your project. So that's just a key point. So if you are a participant in AHI North Country PPS, please look for the 2-page project summary that Tripp mentioned that we will have out to you shortly, and that's what we'll be expecting to be back by December 30th, so we can get a sense of the total projected capital submission for the region, and that will allow us to have a month or so, or a month or two, to really evaluate and prioritize and really have a good solid application. And now I think we're ready for Q&A.
If you can raise your hand on the side if you have a question, and then I'll unmute you to take your questions. Okay, and our first question is from Craig Amos from BHSN. Craig, you're unmuted. But we can't hear you, Craig.
I can actually see Craig's question here. He's asking what types of things might an organization be able to utilize as match?
Well, certainly cash and debt. And the other thing that was interesting is that they said you can use as match things that don't qualify for capital funding. So things that are operational in nature, apparently, those would qualify as match. And where I think it has the most applicability is in the HIT world, because so many of your HIT applications have expenditures related to monthly fees, subscription fees, maintenance fees. None of those would be considered capital, or you wouldn't be able to use those to submit for a project, but you could use those things for
Follow-up question is, would that include salaries?
We can verify more, but potentially it looks like it does. But again, it's kind of hard to figure out how you would do that. I mean, over how many years would you figure out a salary? Is it just during a startup, or I don't really know. Those are good questions.
Under the list of excluded expenses, it does say personnel costs, and we know that excluded expenses are valid forms of matching funding. So to the extent that you could sort of budget that out and plan for it and say that you're going to cover your personnel costs, that would count as match.
Does anyone else have any other questions? All right, well, at this time, if you have further questions, please feel free to send an email to the DSRIP CRFP at adkhi.org, and we'll make sure to get back to you with an answer. Otherwise, thank you for attending today's webinar.